when should teeth be removed and when should we try to keep in, basically? This is a very old question in dentistry, not only when, but also how. It's a very old question in dentistry, but compared to 20 years ago, the answer has changed. No, the question is the same, but the answer has changed. In the old times, dentistry was always trying to repair teeth, to keep the teeth in. Actually, this is what the patient wanted, and there was no other option. And then the phase of these osseointegrated implants started approximately 30 years ago. So implants were available, but they had a lot of disadvantages, a lot of side effects. For example, perimplantitis, bone augmentation was necessary very often, healing times and so on. So these old implants, these osseointegrated implants, were not really a competitor to the teeth. With the modern corticobasal implants, with these polished implants designed for immediate loading, it's a completely different situation. So today, every patient has the chance to decide by himself or herself if they want to live with their own teeth or if they want to get rid of their teeth. Now, of course, the indication to remove teeth is, of course, given if teeth can't be saved at all. That's, of course, clear. I mean, we will not play with something that we cannot repair. But how much effort should be given into the repair and how much money should be invested into teeth, actually into ailing teeth? This question is answered today completely differently, because we have implants which can replace teeth immediately. It means the teeth are removed, implants are placed, and in 2-3 days the patient has fixed teeth back in the mouth, and they are going to last. I mean, it's a lasting solution. I'm not saying that there's never any complication or never anything has to be repaired, but basically implants are reliable today. Modern implants are reliable today. So as we have these implants, the indications for keeping the teeth are, of course, reduced. Now, on the other hand, there are patients who want to live together with their teeth forever. Of course, these patients will be treated by dentists. The dentist is going to save the teeth. They're going to put crowns, veneers, do aesthetic things, and so on. So this will be done, and patients will pay this. On the other hand, from the economic point of view, I would say it's a luxury to repair teeth because it requires highly qualified dentists, highly special materials to do this, highly qualified dentist technicians. So a lot of people are working on repairing teeth, whereas the removal of the teeth, the replacement by corticobasal implants, is a very, very simple, straightforward solution, and it saves a lot of time. It actually saves a lot of money, although the primary investment is higher compared to, let's say, putting a few crowns on teeth. But on the long run, as we see now on long-term studies, it is much cheaper to remove the teeth and to put corticobasal implants, for example, the strategic implant. So the indication for removing the teeth has really changed. So if the patient wants to keep the teeth, we leave them in. Of course, we will not discuss this. If the patient wants to remove the teeth, we can fulfill the wish. Also, if the patient wants to remove the teeth for aesthetic reasons, for example, I'm showing you here a case of a patient whose teeth basically were not so bad. I mean, periodontal treatment, some new crowns, this would have improved the situation. But it wouldn't have solved the problem. No? The problem is the same. Teeth simply are in the wrong position. This is the problem of the patient. And this cannot be treated in this age with an orthodontic treatment. Simply the teeth has to be removed, some bone has to be removed. So the whole masticatory system, the chewing system has to be set up new. And this starts with removing the teeth. If the patient doesn't want us to remove the teeth, then we cannot help her. It will stay all the same. She will better go to the dentist and he will do a new set of crowns. And as we see in our clinics, most patients are more than willing to remove all of their teeth, even good teeth, if they are shown that there's a good chance, a very good chance, that they're going to have fixed teeth on implants. There will be less infections, I mean no infections basically. These modern implants have shown no perimplantitis. This is very, very important because the old implants, osseointegrated implants, get lost usually due to perimplantitis. So this starts after 3-4 years and then they start coming out again. There's of course no alternative to teeth. So if the tooth would last, let's say 10 to 15 years, it makes no sense to replace this tooth by an osseointegrated implant which lasts maybe 7, 8 years or 10 years. But with the corticobasal implants, we don't see this problem. They can last forever if maintained properly, if patients come for control. Then this is a much better solution than the teeth, especially ailing teeth, because 99% of the problems in oral cavity are stemming from teeth. I mean, teeth are the rascals, let's say, in the body, so it makes no sense to repair teeth in my view. I mean, it's not only my view, it's also my experience. I'm probably one of the few guys who has really a lot of experience. I mean, I'm doing this 30 years. I work with polished implants and immediate loading protocols. So I know exactly that these implants really are a very, very good solution. And for patients who are anyway not too much in love with their teeth, we can offer to take them out and give them fixed teeth in 2-3 days.